Welcome to the Miller Report, Real Clear Journalism. I'm Maggie Miller. Today we're discussing controversy in New York State over a key safety net hospital that is seeing a possible billion-dollar funding shortfall, a takeover, and mounting investigations. Here's what Real Clear's Ben Weingarten found. The 530-bed Nassau University Medical Center in East Meadow, Long Island, serves approximately 270,000 patients a year. They discovered what its former leadership contends is a 2-decade-long funding arrangement that shortchanged the hospital of about $1 billion in matching funds. According to the hospital's recently fired CEO, Megan C. Ryan, the state of New York required the hospital to cover what should have been the state's contribution to a Medicaid federal match, around $50 million annually for roughly 20 years, a practice that has been flagged as improper. Last December, the hospital sued the state, looking to recover some of what it believed it was owed. Shortly after, Governor Kathy Hochul took control of the hospital, and existing leadership, including the hospital's CEO, were fired. Nassau County executive has called the takeover illegal. State officials argue that due to the billion-dollar deficit, a takeover was a necessary intervention. They also argue that legally, the hospital's contribution towards the non-federal share of Medicaid matching funds was permissible under federal law. Critics accuse the governor's office of using this hospital as a political pawn. They point to redevelopment interests. The hospital does sit on nearly 100 acres in a high-value suburb, and some of the new oversight board members have ties to housing development. The saga has drawn the attention of the Federal Bureau of Investigation and of congressional Republicans, some suggesting that the alleged financial scheme is part of a broader effort to save the state's balance sheet by shifting the Medicaid burden to counties and low-income hospitals. All of this is in the backdrop of the 2026 gubernatorial election, where Governor Kathy Hochul is expected to run for re-election against Representative Elise Stefanik, and healthcare looks to be a key issue. The future of Nassau University Medical Center and the services it provides to vulnerable patients is uncertain as this funding and governance dispute plays out. I'm joined now by the lead investigator on this story, Ben Weingarten. Ben, thank you for joining me.
Thanks for having me.
So let's start by having you explain what exactly was happening with the money and this hospital, and just tell us how this situation became so messy.
Well, where to begin? This story centers around a safety net hospital out in Nassau County, just east of Manhattan, out on Long Island in New York. And this is a hospital that serves anyone regardless of their financial wherewithal. So a substantial percentage of folks are on Medicaid or Medicare or cannot afford the hospital services they end up using. And it's the major safety net hospital out in Nassau County, serving hundreds of thousands of people annually. Consequently, because of the financial challenges of serving a population like this, you have federal matching funds that are a huge piece of the puzzle in terms of being able to keep this hospital relatively financially viable. And of course, it's the state or local authorities that put up their share of the match. And oftentimes there have been issues around purported schemes where states put up a match that looks like it's artificially inflated. And so you've had federal authorities upset at times about these matches under various federal funding programs and regimes. But in this case, what happened is that over multiple decades, you had the financial status of this facility get ever more precarious, with growing losses annually, and as a consequence, ballooning liabilities. And the hospital itself, it should be noted, in some ways, is a political entity in the way of those who oversee its operations, which is to say that you have this hospital, which is, it's not a government facility or per se, but you have county leaders as well as the governor, among other authorities, who are responsible for picking the boards of directors and the chair, and ultimately you'll have say over who actually serves as the CEO, who operates the place. And in Nassau County, you've had Republican county executives leading that county as well as Democrats over the last couple of decades. You've pretty much had uniformly Democrat governors for the last 20 plus years, 30 years almost, in New York as well. So you have competing political entities who determine who actually is responsible for overseeing the operations and, of course, shepherding the finances of this hospital. And over time, this scheme developed whereby instead of the state or local authorities putting up their share of the match to receive these critical federal matching funds, and we're talking about a $50 billion match annually, so $100 million every year potentially, and that's over a very long period of time, the last 20 years, 30 years. Essentially, you've had the hospital's funds themselves being posted to cover the non-federal match. And it was sort of the hospital puts up the funds, they go to the county wires them to the state posts them to the federal government, and then the funds come back, federal matching funds, and then effectively the hospital's own funds. And when a new leadership regime came in 2024, they did sort of a wholesale auditing of the books, reviewing of how transactions work, and even the basic systems within the hospital. And what they found is this scheme doesn't make sense in their view. How can it be that it's the hospital itself putting up its funds for the match instead of government authorities who are generally responsible for putting up their end of the match? And so they raised this in negotiations with the state government to try and bring in additional state aid to help keep this facility financially viable, on top of a whole slew of reforms that this leadership team engaged in that they claim led to significant operational improvements as well as significant financial improvements and improvements in terms of the cash position of the hospital, and also in terms of their ability to actually potentially be more than break even in the near term, as opposed to hundreds of millions of dollars in losses that had accumulated in prior years. And they raised this scheme to the state, and the state challenged them, and ultimately they filed suit against the state authorities as well as other authorities that have financial oversight of this facility, claiming that this scheme where the hospital put up its own funds for the match basically defrauded, effectively in layman's terms, the federal government, and that you can't put up the hospital's funds for this match. And so that was part of one squabble, a messy squabble. And then during the pendency of that case, you actually had the state government itself and the governor effectively take control of the hospital, take its power out of the hands of local county leaders. And that led ultimately to a series of management changes and continued litigation. But this question of was this match put up by the hospital legitimate or not, the courts never rendered judgment on it because Governor Kathy Hochul took over that hospital effectively. New board of directors came in, new management came in, and they quashed the suits that the hospital had brought against the state because obviously the state disagreed with that suit. And that's one of a series of different legs of this saga that we lay out just a fraction of in this investigation at RCI.
And I mean, you just touched on it basically, but there's so many stakeholders in this situation. It also seems like it's a big case of the blame game almost. You've got state versus local, Democrats versus Republicans. So how do we get to the bottom of who is at fault, or is it just a case of there might be multiple people who are at fault?
Well, I think without rendering judgment myself on how things played out, I think what the record shows is that, first of all, it's very hard for a facility like this to be financially viable without substantial government funding. And that's almost by the nature of it, because those who are served by these types of facilities themselves don't have the financial wherewithal to pay for their care disproportionately. But beyond that, I think what it shows is how messy and hairy it is when you have all of these different authorities. Like you said, the federal piece of this is almost the most simple piece. States have all sorts of plans that they ink with the federal government when it comes to their Medicaid plans and how they operate. And the federal government provides its match and it goes its merry way annually. But at the state level, you have these different stakeholders, like you said, different state entities or county entities or state-controlled county entities may have financial oversight of facilities like this. In Nassau County itself, there's this authority, NIFA, this interim financial authority, which is basically there to not as a receiver, but something like an overseer of the county's finances that is state installed and essentially state led. And they had responsibility for overseeing the finances for many years at this institution, reviewing every contract, et cetera. But like you said, particularly when you have a situation where state authorities are in control of one party and county authorities are in control of another party, and they're both responsible for picking who the leadership is in an institution that has to operate, that has to be a non-political institution when we're talking about a medical care provider. At the end of the day, it makes for an incredibly messy situation. Very difficult to see operations running smoothly in an environment like that, let alone the finances ultimately working out well. And like you said, it is a blame game. You have Democrat operatives in the state who claim, and we quote one of them, that this hospital was a Republican patronage pit. But of course, that claim is challenged by the fact that you've had Democrat county executives with their handpicked boards of directors and CEO leading the institution, or management leading the institution that answers to then Democrat leaders at the county level. So very hard to say who's right and who's wrong. What were the series of decisions and who was responsible for them that ultimately led to a place where you had massive losses and a deficit totaling around $1.4 billion collectively. And this, I think, reflects in part the challenges almost inherent to the idea of when you have political leadership that is inherently and inextricably intertwined with something approximating at least a business or something approximating a private sector entity. And it's particularly hairy, of course, when we're talking about all important healthcare, in this case, a safety net facility. And then on top of it, you have New York State's budgetary issues themselves. And there are reports claiming, and I think there's evidence to suggest, that the state's looking to save everything that it can, including when it comes to spiraling, ballooning healthcare costs that the state has been on the hook for. And that's another element of this as well. And Republicans have alleged that this is part of a scheme to essentially short facilities like these of state funds and put it on counties, put it on local authorities, which of course means higher taxes within those counties as well, not popular with voters either. And again, this reflects part of the mess, of the broader mess that is healthcare, which of course we're seeing play out in this continuing shutdown fight, which may or may not be ending this week.
Would you also be able to quickly touch on how this situation will come into play in the 2026 gubernatorial race? Obviously, healthcare is going to be something that's going to be discussed and going to be up for contention. It's going to be something that Elise Stefanik is probably going to definitely bring up this hospital, I'm assuming, when it all comes down to it. How do you see this coming into play?
Well, no doubt, anything that deals with New York State's budgetary ills, increasing taxes, tax burdens on voters, and then in particular, when you're talking about a county like Nassau County, which is sort of purple at this point and arguably trending red, and then we'll see to what extent there's an impact from the New York City mayoral race on these suburbs outside New York, whether it pushes them more red or not. These are massively important counties, like the likes of Nassau and Long Island, and massively important issues for New York voters. Healthcare has been something that Governor Hochul has been touting the state's healthcare operations, and it's been something that Representative Stefanik has been challenging. And she's, of course, announced that she's going to run, and she likely would be the front runner. There are polls suggesting substantial narrowing between these two candidates even before Representative Stefanik officially announced. So you can expect that if healthcare is going to be a substantial issue, and it seems like it will be, that this hospital in particular is going to come up. And this will likely be a hotly contested race after we saw then Representative Lee Zeldin come pretty close to flipping the state red last time around when New York had a gubernatorial election. So Expect this to be a very heated race. Obviously, you have New York media itself, which gets amplified to the nth degree nationally. And to the extent this is the competitive race that it's likely to be, with two popular, prominent political figures, suspect there will be massive debates over issues including healthcare and perhaps particularly around this facility as well.
And then finally, as we go about wrapping things up, there are multiple paths that can happen from here. Obviously, maybe the hospital gets fixed. Maybe it is downsized. That was another option discussed. Maybe it is done away with, and then they do these housing options that people are claiming are something that people are interested in. So how does this affect the people who rely on it? And do we see something tangible coming soon for this hospital, or is it really just a waiting game right now?
Well, you've seen state authorities say that essentially prior management did a poor job and the state's cleaning it up, and the state is dedicated to making this a facility that can work for those who need it. And at least I think it's been reported through the end of this year, essentially, keep it viable. It may well be that the state intends to pump funds into this facility and keep it as is going forward. But 5 years back, that financial authority, this NIFA authority, which is led by governor-appointed individuals, that is now Governor Hochul appointed individuals, it funded a report by a turnaround company, which said essentially that the way to make this place viable is to massively downsize it from 3,400 full-time employees or so to around 300, to dramatically shrink the size of this facility, which would necessarily, of course, mean less care. It's not clear what would fill the gap under that plan in terms of the demand. In speaking with folks around this story, though we didn't report on it, my understanding is that some think that there might be federal health centers that come in and might fill that gap in places like Nassau County, but it's yet to be seen. And to your point, there are some who are very skeptical of what the state's doing here, who think that the plan has always been to ultimately shrink, downsize, shutter this facility. The land is extremely lucrative, and there's the thought that based upon what the governor has said about her plans to massively increase high-density housing and the backgrounds of some of the folks who might be the decision makers involved with what to do to make this ultimately financially viable, whether or not it's operationally viable, there is a supposition that maybe there would be a sell-off of land and ultimately the building of high-density housing, which the governor's critics and the Democrats' critics really within the state think is all about trying to juice Democrat votes. The idea being that you have substantial high-density housing. Those who take up that housing are likely going to be Democrat-aligned voters, and that's going to mean substantially more blue votes in Nassau County. Whether or not that's how it plays out is yet to be seen. Newsday has reported that everything is on the table under new leadership within the hospital, including talks about developers potentially kicking the can around developing on that land. So at this point, it's stay tuned and we'll see what happens. We'll see if this comes up in context of the gubernatorial election or otherwise, if there are potentially other triggers that may come up with respect to the financial viability or lack thereof of this institution. And of course, the fact, which we haven't even mentioned, that there's congressional oversight that's going on right now around this facility, as well as allegedly an FBI probe into what has happened there. So stay tuned across the board at the state and the federal level as well.
There are so many pieces to this pie that it's fantastic to have you on just to be able to give that picture and give that insight. Ben, thank you so much for your time.
Thanks for having me.
That was it for the Miller Report, Real Clear Journalism. I'm Maggie Miller. I'll see you next time.